A stroke is the result of a lack of oxygen reaching the brain, leading to a sudden death of brain cells, either due to a blockage from a blood clot or a ruptured artery within the brain. There are two major types of stroke: ischemic and hemorrhagic. Ischemic strokes are caused when a blood clot blocks the flow of blood to an area of the brain, leading to the death of cells. Ischemic strokes can also be caused when a blood clot from another area of the body is swept through the bloodstream towards the brain and blocks the flow of blood. This is known as an embolus. Hemorrhagic strokes are caused when a vessel within the brain bursts or ruptures, causing blood to leak out of the vessels. This can be due to uncontrolled high blood pressure, the overuse of anticoagulants or blood thinners, or an aneurysm, which are weak spots in the blood vessel walls. The main symptoms of a stroke are: has the person's face fallen on one side? Can they raise both arms above their head? Does their speech sound slurred or disjointed? Other symptoms may include experiencing a headache like nothing ever experienced before, having trouble seeing in one or both eyes, or sudden confusion and difficulty walking. If you or somebody you know experiences any of these symptoms, go straight to hospital. There are risk factors that can lead to an increased risk of experiencing a stroke: high blood pressure, high cholesterol levels, age. Nearly 3/4 of strokes occur in people over the age of 65. Diabetes, cardiovascular disease, a family history of stroke. Gender. Men are at a higher risk of having a stroke at a younger age than women. Diabetes and heart disease, both risk factors, are more common amongst men. More women than men die of stroke. Women tend to live longer than men, and the risk of stroke increases with age. Being overweight, a lack of exercise, and smoking. If you smoke 20 cigarettes a day, you are 6 times more likely to have a stroke compared to a non-smoker. But there are things you can do to reduce your risk. Exercise regularly, eat healthier foods to lower cholesterol, and stop smoking. After 1 year, your risk of a heart attack is half that of a smoker. After 10 years, your chances of developing lung cancer fall to that of half of a smoker. By 15 years, your risk of having a stroke is around the same as someone who has never smoked. However, there can be lasting complications after having a stroke, such as behavioural changes, numbness, paralysis, a weakened ability to sense temperature changes, speech difficulties, and muscle weakness. So call an ambulance as soon as you see the first symptom in order to reduce complications. There are different treatments depending on the type of stroke. Ischemic strokes need clot-busting drugs to be given within 4.5 hours of symptoms starting in order to dissolve the clot rapidly. Hemorrhagic strokes are usually treated with antiplatelet drugs and may need surgery depending on the severity of the bleed. Treatment after 12 hours is unlikely to be useful in regaining full health.